Hi, everybody. Well, now that we've removed our masks, we can hold our interview 6 feet apart just to stay safe. My name is Michelle Kavall. I'm president and founder of Quality Healthcare Concierge. We are a holistic care home health company in Palm Beach County. We're here today to interview the lovely Dr. Michelle Weiner, and she is part of the holistic care mission that we are on today. And we'd love to get some information on her business, her mission, and why she's a part of what we do today.
Well, thank you. I'm really glad to be sitting down with you. So, I've been using medical marijuana in my practice for almost 4 years now, and it's really made a huge difference in my patients' sleep, pain, mood, and it's really something that we need to get the education out there about getting rid of the stigma, the fact that it's something that is a natural way of making a improvement in quality of life, and it's something that patients need a personalized treatment plan. And the most
Sure.
important thing is that, unlike most pharmaceuticals, where everything works in a certain amount of milligrams, certain amount of times a day, cannabis is a little bit different. It's very patient centered, and each patient reacts differently. And so sometimes we need a little bit more care when we're dealing with patients starting cannabis who are more cannabis naive.
Thank you, Dr. Weiner. Tell us a little bit about yourself, how you got here, how your name has become so prominent here in Florida, and what are your passions about what you do?
I consider myself an integrative pain management physician. So
Sure.
I did a fellowship in pain management and was more interventional. And as time went on, I realized that a lot of the treatments that I had for patients were very short acting band aids and not really tools that can get to the root cause of the problem. And so I started using other botanicals, CBD, cannabis, using therapy to help people uncover some trauma that may be causing a lot of their pain right now. And by doing movement and nutrition and really dealing with lifestyle changes, patients were able to have a complete turnaround in their lives. And so I started using cannabis, and patients were able to get off their opioids. They were able to sleep better, get off their medications for anxiety. And now, really, being an integrative pain management physician means looking at the whole patient. And by looking at the whole patient, we're able to take away some medications and give them back their quality of life and start having them to be more active and incorporating movement and better choices. And I see that once we initiate cannabis.
You had mentioned quality of life, and that's a part of our mission, right? We are all for patients having an increased quality of life, aging in place, and more importantly than even those factors is having a personalized and individualized care plan for our patients to age in their home, to age where they're comfortable, to age where their loved ones feel comfortable with their process. And we want to understand, where does holistic care come in, and what part of the process are you involved in, and how can your educational background really help support this?
I think that patients sometimes need personalized care when they're dealing with something that is unknown. And so when we start educating patients about cannabis, we don't know how sensitive they are to THC, which is the intoxicating cannabinoid in the plant. We don't know how they're going to respond to certain milligrams, and they need education on how to use it. If it's going to be inhaled, if they're going to take drops under their tongue, if they're going to use a topical cream. And so the therapeutic alliance is really important. The fact that we can work together and be on the same page to help guide a patient to make better choices will be very effective for the patient to have a better outcome in the long run. So it's really taking Western and Eastern medicine and understanding that for acute conditions, we have Western medicine, we have pharmaceuticals, but a lot of things nowadays are chronic conditions. And so patients have chronic disease and they don't feel that they can reverse these conditions. And so things like cannabis are able to get to the root cause of their suffering, and then they're able to connect with themselves, which is really important because, especially now with COVID-19, we're going to have this second pandemic of mental health and mental illness, and people need to feel connected to others, and they're not able to be with others, so they actually should be self-aware and connecting to themselves. And cannabis really gets you in that space where you can be aware of why you're choosing to medicate, how your body is feeling at that time, and then have some guidance as to pick which product would be best for you at that moment. And so it's important that the patient trusts us as we work together, and also that they're able to understand the concept. And some people need more guidance than others, and really it's all about educating and getting rid of the stigma behind how cannabis got to be now used as a very effective medicine.
It's really exciting for us to know that we have the ability to work with physicians such as yourself. And you had spoken about the stigma. So talk to us about the stigma. Talk to us about a little bit about your practice. Where do you practice? Where can we send our clients? Where can we send our patients? And talk to us about your comfort level with the process. How do you feel about your clients, your potential clients, your returning clients coming into your office with a companion from Quality Healthcare Concierge, one that's really been holding their hand and walking them through the process in the comfort of their own home, and then coming to you and reporting off to you and giving you, as the practicing physician, that comfort level of, okay, I've recommended such to my clients and they have been practicing my recommendation, and here's the outcome and here's the actual proof, because they're still on board with what I'm recommending. They've come back, they're giving me the feedback, and I'm seeing, more importantly than ever, an increase, a better outcome of their process, of their holistic care process.
Sure. So I have a few offices. I'm in Kendall, I'm in Coconut Grove, Hollywood, and Boca.
Okay.
And the reason I'm in so many offices is really because I'm so passionate about getting rid of patients' pharmaceuticals and improving their quality of life and giving them another option. And I find that patients who are interested in medical marijuana, they may hear from another patient or friend or family member that they use it and it helped them, but their use may be very different than another person's, because everybody has an endocannabinoid system, and this system in our body is something that is based around the fact that we make these naturally occurring cannabinoids, which is in the cannabis plant, and they activate certain receptors, and the point is really to keep us all in balance. And so when we have a symptom like we can't sleep, we have pain, we have anxiety, it's our body telling us one of these neurotransmitters are not in balance. And then by taking cannabis, like another vitamin or mineral, it's able to give our body what it needs to make its own and then keep us in this homeostasis. And so I really have so many offices because I want to reach so many demographics, and I want to be able to work with other physicians who I can educate or who can send me patients so that I can better help their patients, and also work with Quality Healthcare Concierge who can personalize these treatment plans. And I'll give you a great example. I have a very close friend whose mother was just diagnosed with cancer. And I have thousands of patients on cannabis, but now I see firsthand what the struggles and what the challenges the patients and the family go through. So once you see a physician and you get your medical marijuana card, it takes about 7 to 10 days to get approved by the state. There's many different dispensaries. There's all different ways of using it. It doesn't have to be smoked. You don't have to get high. But the bottom line is, once you do get that card and you go to the dispensary, you're at the discretion of the person who works behind the counter. And so even though I make recommendations, the person still can buy whatever they want to buy. And so it's really important to get guidance along the way. So for example, this family member, she has never used cannabis, but now she has a new diagnosis of cancer. She's dealing with anxiety, depression, pain, nausea, vomiting. It's really affecting her and the whole family. And so what we've done is we've used different preparations of cannabis, because I have knowledge of obviously a lot of the products, but she's never used cannabis before. And at first we started letting her know, look, this can increase your appetite, this can treat the nausea and vomiting associated with chemotherapy. And so she started off being okay with it. And then what ended up happening over time is she realized it was really relaxing her, it was elevating her mood, she was laughing at her television shows, she was able to sleep better. And to customize it for the patient is really important, so that she now is able to know, I have pain. Which preparation should I use? Should I use a combination of CBD and THC? How many milligrams? How long do I want the effects to last? So personalizing it is really important, and a lot of people need help. And so even me right now, I'm seeing how a very close friend and family is dealing with this, and there's so many questions throughout the day that sometimes people need help, and I have hundreds of patients who are able to wean off their opioids, but they needed help along the way, and I can email them, but it's different when you have someone sitting with them, guiding them, because a lot of times they're hesitant, they're nervous about if they're going to feel high, what that's going to feel like, and they just need the reassurance and, a little bit of hand holding.
We're so excited that you're an advocate just as we are for the naturalistic process. We love the fact that you've been in this industry for a long time. We love the fact that you're a subject matter expert, and we really do want to say thank you for your time, and we are so appreciative of being able to interview you. And just as a segue to the end of our discussion here and the end of our interview, do you mind giving us a little 101 of an educative session for our clients and our watchers today of our interview on what it is, what is the endocannabinoid system, what are the different parts of the plant that are utilized, and how do we utilize these products? Just a small 101 so we can feel like we've gotten our educative support today.
Sure. So the actual cannabis plant, so cannabis and marijuana, the same term, the cannabis plant has over 400 components. It's made up of cannabinoids, terpenes, flavonoids, a lot of things that are very medicinal. The two most prominent are THC and CBD. So most of the dispensaries have combinations of those two cannabinoids. And it's important to differentiate the two. So CBD doesn't cause any of the intoxicating effect. We use it for inflammation, for anxiety. It helps people with sleep. And then the other thing is that it can counteract the high when you're using THC. So THC does cause the intoxicating effect. It's what gives the stigma to the plant, but it has a lot of medical benefits. It helps patients with pain, with sleep. It can help patients who have cancer, who need to increase their appetite or treat nausea and vomiting. It definitely can elevate their mood. We use it for seizure patients, Parkinson's, a lot of the neurodegenerative diseases. So these two cannabinoids are basically what the dispensaries have in different forms. It can be in oil, it can be inhaled, it could be a capsule, a topical cream, a patch, many different forms. And then we all have our own endocannabinoid system. This is what makes us all unique. And the endocannabinoid system is a system all throughout our body. We have these receptors. We make these naturally occurring cannabinoids. They activate our receptors and keep us in balance. And so there are certain things we can do to keep ourselves in balance, like exercise, eating healthy, not smoking, decreasing our pharmaceuticals, which is affecting our neurotransmitters and our endocannabinoid system. And so some people, for example, who have fibromyalgia or chronic fatigue syndrome, they don't make enough of their naturally occurring cannabinoids, and they need to supplement with the cannabis plant.
Right.
And then others are dealing with specific symptoms that they need to calm that down by using certain amounts of the cannabinoids in certain preparations. So it's really maintaining this balance in our body. And it's a very safe plant because we can't overdose from it. There's no toxicity. There's no respiratory suppression. We can take it with other pharmaceuticals and help us then decrease the amount of meds we're taking. But it's something that over time, people who start to use THC realize that it has the benefit of actually opening up their mind or making them look at certain things in another way that they may not have been able to do unless they were able to connect with themselves. And so you can get CBD from hemp, but you can also get CBD from the cannabis plant. And the benefit really of CBD, again, is that you can use THC without being high. And so we like to use the two of them together and then have the patient be informed and empower the patient to participate in their own health care. And that's really the shift that we're going to, see, is that a lot of patients are frustrated with physicians and they're frustrated with medication management and they want another option. And so having someone who can personally make a treatment plan that's an individualized plan, not just based on the condition you have, but based on who you are as a whole person, is going to be much more effective and long term, because you'll be able to allow the patient to be educated and then be able to be an active participant in their health care, as opposed to just passively, waiting for the physician to respond. So I think the point of having that therapeutic alliance, the fact that we work together, is going to be even more effective for the patient, and they'll feel that we're available to them and that we're personalizing it for their condition and then who they are in general and what their goals are.
We are so excited to be working with you. And we're excited to be aligned, and mostly we're excited to be on the same mission, right?
Right.
We're on this holistic care mission, holistic palliative care, symptom management of our clients and our patients, And we're just here to make it better for our clients and bring longevity to them living in their homes. To managing their symptoms, to managing their comorbidities. Different sorts of comorbidities that they may have. And we're excited to be working with you. And again, we're so appreciative of your time. Thank you so much for taking this interview. And we look forward to what's coming next.